I was here in All India Institute of Medical Sciences, and this was 1971 when I came here. We were 3 registrars, and I was the junior most. First one, Dr. P. N. was the professor. Dr. H N Agarwal, he was the assistant professor, he is associate professor, and Dr. Prakash, he became recently assistant professor. This is a temple of education. When I came here, I was practically raw because I was in KG Medical College doing my MS. My thesis was on neurosurgery, and I was sent by my professor there. Whatever you wanted to teach you, we have taught. Now you go to AIMS. So he wrote to Dr. A.K. Banerjee, and there was an interview, and I was selected, and I came here. They were very, very strict. Dr. Professor Pandan, Dr. Banerjee, Dr. Prakash, they were very, very strict. So whatever they used to say, we were bound to complete in the night and at the cost of our sleep. There used to be time when we were working 72 hours all together. Once I will tell you one incident. It was my third day and 2 nights. I was working, so I asked Professor Banerjee, I have done the angiogram. Now please come and operate this patient in case of brain abscess. He said, Dr. Agarwal, you can do it. I know you can do it. I said, I can do it, but I am very sleepy. He said, go ahead. So I went to the theatre. I operated the patient. It was 3 o'clock in the night when I saw that no, there is not one abscess, there is another abscess. And I was so sleepy that I was hitting my foot from this, right foot to the left and left to the right, so that I keep myself awake. And then he sent, my anesthetist sent SOS. He is feeling very sleepy. He has removed both the abscesses, and please do something. So he said, yeah, I am coming. So when he came, I have finished the surgery, except that he was a closer. I said, I will close and you go and take rest in the hostel. So there was a hostel just behind, and I went to sleep. I forgot what it was, and next day when I got up, there was a knock at my door, and then I just got up and I said, oh, you have come. Hardly I slept at 4 o'clock in the morning, and now it is 7 o'clock and you have come back. He said, date has changed. So this is one incident which I told you, this used to be like this. After doing my MCH, luckily I was married here. When I was a registrar, I was married. My wife, Asha Agarwal, she was UP Mehta. She was working and doing PhD in neurology. At that time, all my professors, they came and joined me, and we was married. After doing this MCH from here, I went to other side of the road, Southern Hospital. I started working there. It was nice to have so many years, 3 years here. And then after this, I went to Iran, and there I stayed 5.5 years. And then I came back and joined Gangaram Hospital. This is very, very important. I think when I started 25 years back, because Dr. Mehta was there, Dr. Charlie Drake came from US, and he wanted to operate one case, and we were not having a case, so I had one case of AVM. I brought it from Gangaram Hospital, and he operated it. That time there are so many gadgets were not there. There was no microscope or anything. We were using loop. So this was somewhere about 1983-84. And he operated my case. So from that, this alumni means this microneurosurgery conference is going on. And today is the 25th one. So we are celebrating Silver Jubilee. Alumni, every year we are meeting somewhere, either here or we are meeting in a neurology annual meeting. There also, Dr. Banerjee used to have alumni. They used to have a photograph, they used to have some tea, coffee, and we used to talk about each other. And this is going on marvelous. At least by this, people know who were there, who are here now. And whenever somebody coming from AIMS, I feel as he is coming from my home place. Professor Dr. H N Agarwal, gem of a person. Academically, I have never seen a person like him. Dr. A.K. Banerjee's his microsurgery, his surgery was so good that we learned surgery actually from. So all knowledge coming from Dr. P. N. and A.K. Banerjee, and our surgical hand was coming from the A.K. Banerjee. That sort of thing came. And I will say, whatever they have taught, first thing is we never stopped. Wherever I went, there was hardly any instruments. But we never stopped surgery. We did the best, whatever was good for that patient that time. And we really learned those basic things which a person does not see today. Because today you have got so much of equipment, so many things. There our clinical knowledge, then investigating our own cases like angiography, myelography, pneumoencephalography and all that, all those things have disappeared. Every 10 years, the neurosurgery changes its face. I have seen, I'm lucky that it's practically now 50 years, I have been here, 71, you know. And I have seen every 10 years this neurosurgery change and change its face, the type of surgery. We learned here one thing, the tumor surgery mainly. But now we can enter anywhere, wherever. This is possible in today's day. I will just say work hard and you will be able to do the way you have been taught here.